Have you ever had back pain to the point where it feels like it's frozen and that pain is so strong that you feel stiff, maybe even electrical or burning sensation, and sometimes it can even shoot to the legs, and you're frustrated because sometimes that pain gets to the point where sitting, walking, and even sleeping becomes difficult, and you're also wondering what else to do because you've tried the stretches, you've tried the creams, you've even tried the meds, and nothing's really helping. What's going on here? So today I'm going to take a deep dive into looking at the low back pain specifically, and things we can do to get better so you can have that quality of life again. My name is Dr. Sandy. I've been practicing chiropractic now for over 25 years. I've been blessed. I love what I do. And in the 25 years, I've personally performed over 300,000 chiropractic adjustments. Me and my team have won multiple awards, and we've been blessed because we are helping people get results. So let's just take a deep dive into it. So when we actually look at the low back, it's a term that might get used. People talk about the back. It's a very general concept, but let's take a deep dive into that. So I have this model here, this skeleton, and when we look at the low back, we're talking about anything in these areas. So it can involve the lumbar spine. I think a lot of people are familiar with that. That's like L1, 2, 3, 4, 5. You also have the tailbone area where you can see there's a huge amount of nerves that are coming out of there as well. And you also have your hip area. That's called the ilium. We also have the ischium down here. So all of these areas are talking to each other. You even have the femur head involved as well, which is a fancy way of saying like the leg bone. So we have a massive hip joint here. We have the lower spine. We have the tailbone. And everything needs to be in sync. And if any of these areas are locked or jammed and compressing a nerve, we lose function. Now, the typical story I can tell you that I hear in my office is, I would say over 90% of the time, it's people where they've had occasional back pain. They thought they'd stretch it out, relax, maybe even massage the area, things like that. But it just felt like over time, the pain became more frequent, became stronger. And if it gets bad enough, as I mentioned, it can even start to spread to different areas. It can go into the legs, which is known as sciatica. And it is a complex issue. It's not simple to say this one thing's causing everything. You may even consulted another health professional, and they talked about maybe a disc bulge or a disc herniation. So those are the areas that sit between the vertebrae as well. So it is a very powerful area. It's a very delicate area. It needs to be taken care of. But here's the amazing thing is that when this is in proper alignment, when things are moving the way they should, and there's no pressure on your nerve system, you will feel better. And more importantly, you'll even function better. So what does that even mean? So as a chiropractor, in our profession, our focus is looking at the spine. It's looking at the nervous system. We know in the research for sure that the nervous system is the master controller of the body. So if we have pressure on the system, if we have dysfunction on the system, if this system's not working the way it should, there will be breakdown, there'll be inflammation, and there will be pain. And I really want to convey this to you as well, is that I really believe pain is the body asking for help. It's giving you feedback, and it's not something we should just try to diminish. We shouldn't shut it down. We should try to understand what's going on, because maybe we use a certain medication, maybe we use a cream and we get that temporary relief. But if you're not getting to the root cause, it just keeps coming back again and again. So we want to properly analyze this area and say, okay, is it coming from the spine? Is it more the hip area? Is it the leg joint area? Is it the tailbone area? All of these areas have to be assessed and looked at properly. Now, what are the things that can cause those areas to lock or jam? So one would be those misalignments. So when those vertebrae, when those joints are not moving the way they should, it gets restricted and puts pressure on the spine. And what can cause that to happen? That can be movement patterns. So what that means is if you sit all day in front of your computer, if you're on your phone all day, maybe you have a job that has heavy work involved, any of these strains, doing too much, sitting too much, anything that's too much on the system over time can cause a breakdown, a wear and tear on that system. So you want to get it properly assessed, see where there's a locking, what's going on there. Because you also have to remember when the spine misaligns and is in the wrong position, Yes, it'll put stress on the nerve system, but we're talking breakdown process. We're talking inflammation. We are talking a breakdown of the actual bones itself, which leads to degeneration, which is really a compensation system. So we have to look at that. The other thing that can affect these joints, the spinal movements as well, is stress. And let's be honest, we live in a time where there's so much stress, whether we're worried about what we see on the news, we're worried about our family, we're worried about all these different things going on. So stress is a very real factor, and it affects the human body. It causes the nervous system to go into overstimulation, and that overstimulation leads to an inflammation response. Muscles tighten, things are not moving the way it should, there's compensation, and we see this breakdown process. And I just feel as a chiropractor that we need to get back to the basics. We need to teach people how to get to that root cause and fix it. And the biggest thing is, we're not looking, at least in my office, to just get you back to a baseline. Of course, that's a phase one, but we're asking the question when we take a patient on, let's get this person feeling better. Of course, let's help this person, but what are we doing to maximize their life? Our office is dedicated to helping people from pain to high performance. You should be getting the most out of life, because let me tell you something. If there is pain, if there's breakdown in the body, if the body's been neglected for years, it affects your quality of life professionally, with your work, with your family life, and even your personal life. On so many fronts, everything gets affected. And then it's like you're playing catch up and you're trying to manage, and you're to this doctor, to this doctor, and this doctor. Why not get to the root cause, look at it? And another thing I would say to you as well, whether this message is for you or someone you care about, and wherever you decide to go, it's up to you, but you want to take action. When the body is giving you that warning signal, when you're getting those symptoms, it's telling you, I need help, and it should not be ignored. And the sooner you can act on those symptoms, the better your outcome will be. But the longer you wait, you may get recovery. It might be partial recovery. It may not be the way you expected. And the other thing is too, is that something natural like chiropractic is very powerful. It can help people. But if you wait too long and the damage is too extensive, then you might only have injections or surgery as an option. And I believe most people say, yes, that's a tool, and certain people need it, but I believe in my heart, most people are saying, I want something natural, I want something conservative, I want to get to the root cause, I want the best possibility of getting better, I want the best outcomes with minimal risk. And surgery, yes, it can help people, but it's strong, it's working with a delicate part of the body, especially if you're doing a spinal surgery, and in my opinion, it should be a last resort after you've exhausted everything, because it's a strong procedure and you're dealing with the spine. So I would say, be proactive, take care of the body, look for something natural. Chiropractic is perfect for that. And then go to someone who has been doing it for a long time, who knows that area and is specialized in that area. And I can tell you that my passion is to help people. I love taking care of the human spine, because I know when you help people with the spine, it has such a ripple effect on their quality of life, on everything they're doing. And you're really getting to that root cause and helping that person function at a much, much higher level, because you deserve the best in life. It shouldn't just be like, oh, look at me, I'm just not in pain. That's not good enough. You should be saying, okay, I'm not only not in pain, I have energy, I have focus, I have vitality, I am living my best life. That is really the chiropractic message. How can we give you the best life possible naturally? That is really the message. How do we make you at your absolute best expression? That is the chiropractic message. So if you have any questions whatsoever, please reach out to my office. We're here for you. If you just have some general questions, 905-896-3393. If you're ready to take that next step, one thing unique about our office as well, because we are committed to helping our community, we do offer something called a free spinal checkup, where we'll take your history, I'll physically check the spine. We have a computer that does a full analysis of the nerve system, surface EMG. We do all these tests that we go through, and we can tell you where you're at, if we can help, what your options are. But it's a great first step to say, you know what, enough's enough. I want to take care of myself. I want to be stronger. I want to be healthier. So we're here for you. So any questions, if you want to book a checkup for someone you care about or yourself, I'm available at 905-896-3393. That's 905-896-3393. Visit us on the web at gopowerflow.com. Take your health seriously. When you give your health time and energy, it's amazing what can happen on the other end. So I will see you again on another video. As always, God bless you and your family, and stay strong.